Call to order. Let's have a roll call, please.
Kevin Freeman, City of Millwood.
Josh Kern, Spokane County.
Ben Wick, Spokane Valley.
Bob Lutz, Health District.
Tony Smith, Health District.
Karen Stratton, City of Spokane.
Don Condon, citizen. Chuck Hafner, citizen.
Mary Cuny, Spokane County. Andrea Frostad, citizen.
Michelle Fossum, Legal Counsel.
And Constable, Recording Secretary.
Okay, at this time, Kevin, you'd like to make a motion, please?
In the interest of a conflicting meeting, I would ask that the chair consider moving the consent agenda, item number 6, to right after citizen input, item number 3. I make that motion.
Do I hear a second to that?
I will second.
Okay, any opposition? None at all? All those in favor?
Aye.
Aye.
So therefore, we'll take item number 6, and change right after citizen input. We will have then the consent agenda because, is that correct?
And I would also like to make a motion that we move item number 7 up following the new location of item number 6 after citizen input.
I'll second that.
Okay, you want number 7 right after citizen input?
After item number 6, which was
Citizen
moved.
input, I mean?
Yeah.
Consent agenda.
Yeah, okay. Okay.
Thanks, John.
So do I hear a second for that, please?
I have the second.
Kevin, all those in favor?
Aye.
Aye.
Thank you. Okay. Roll call. We will now have citizen input, please. We have 4 people that would like to speak this morning. Keep in mind that they have 3 minutes to speak. We will spend approximately a half an hour for citizen input, at which time then we'll go back to doing our regular business. And then at the end of our business session, if there are other people that haven't spoken that would like to, we'll then open it again for public hearing. So at this time, Jacqueline, if you'd come up, please.
Jacqueline Gallion, City of Spokane Valley. Today I am here to correct the inaccurate claim that Spokane is a hotspot of low vaccination rates or excessive exemption use. Do you remember during the mumps outbreak how it seemed that the infection reports were designed to hide the fact all infections was occurring in the vaccinated? The hotspot study is the same thing. They're misrepresenting vaccine exemption rates to justify the author's opposition to non-medical exemptions. It uses percentages when the numbers are insignificant and numbers when the percentages are insignificant. I am providing you a copy of the recent Spokesman Review article with corrections. The best example of this data manipulation is Camas County, Idaho, which this study says is the worst of the 10 top highest exemption rate counties in the nation because over 25% of the kindergartens use an exemption. This sounds scary until you Google Camas County Public Schools and learn that Camas County has only 143 K through 12 students, and there are only 7 kindergartners this year and 12 last year. This means that 25% we're supposed to panic about is 2 or 3 kids. The whole study is this type of misrepresentation. There are less than 320 kindergarten children with an exemption total in the 10 worst counties combined. Spokane's hotspot designation is the flip-flop abuse of numbers. An arbitrary threshold of more than 400 kindergartens was set, probably just so Spokane could be included. We barely made it with 405 kindergarten students who use an exemption. Over 400 might sound scary to you until you calculate that 405 kindergartens is 0.082% of Spokane County's 590,000 thinly distributed population. It's ridiculous. Please see the data that I have provided. How does a study like this pass peer review? Is this intentional misrepresentation? In the Spokesman Review article, one of the authors is quoted, "I don't know what factors are behind the high exemption use in rural places, but researchers are hoping to conduct a follow-up study on social and demographic factors." Well, let me save you the trouble. If you measure small groups where one person is more than 1% of the population, you are going to get crazy percentages. You don't need epidemiologists to understand that. Look at the absurdity the authors had to resort to in trying to argue that non-medical exemptions is a problem. How does any credible scientist keep a straight face when publishing a mess like this? Obviously, this should play no part in any discussion about exemption use in Washington or anywhere else in the country. All right, and being that we are fast approaching the primary election, I would also like to bring attention to you to the importance of integrity and neutrality of our public employees and our elections system. I have brought to you an email of a board members that suggests the suggestion of electioneering in our last election cycle. This email is disturbing and showcases behavior similar to that of a Spokane City employee who was fired as a result of engaging in the same activities. I am asking the board to investigate to maintain public trust and transparency. This email was obtained through a public records request. Thank you for your time.
Yeah, thank you. Okay, next, let's listen to Aaron Kranzler, please.
Hi, my name is Erin Kranzler, and I'm here today to bring forth some new information that has recently come to light regarding the Health and Human Services Department, the HHS. Robert Kennedy Jr., who is an environmental lawyer, sued the HHS recently for reports that were supposed to be done from the 1986 National Childhood Vaccine Injury Act, which Ronald Reagan signed with the stipulation that reports would be done every few years, showing the vaccine safety oversight. Through the Freedom of Information Act, these reports were requested. After being sued for the information, they were able to find 0 reports. I'm just going to say that again. They did 0 reports. This means that in the past 32 years, there has been no checks and balances from the Department of HHS, who is supposed to be oversighting the CDC. They were not doing their job, which has previously been pointed out in the Informed Consent Action Network white paper document that we read to you guys earlier this year. The HHS has failed on so many levels. Vaccine injury is real, says the $4 billion paid out through the Vaccine Injury Compensation Program, the VICP. We thought it was important to present you this information with these recent findings of no reporting being done and the breakdown of safety. Virtually what this means is that no one is looking out for the most vulnerable, our children. We have passed out the lawsuit. You all have a copy, and we've also brought several copies of the ICANN document if you guys would like to get it, and has a few more of those. Thank you.
Thank you, Aaron. Next, let's have Stephanie, please. You can put it in there.
Oh, is this on? Okay, thank you. Hi, I'm Stephanie Fragshaw from Spokane. Thank you for the chance to speak today. I'm the mother of 2 young boys, one who was vaccine injured in February of last year. I shared his story the last time that I was here. I've missed the last several meetings due to his ongoing health issues, including a lengthy stay at Sacred Heart for new and different seizure activity. His chronic health issues are why this topic is of top priority to me. A few months ago, we delivered some letters to the board in regards to why exemptions were important to different individuals that live in Spokane County. We understand that there was not legislation that was proposed this year that would have moved forward with limiting exemptions. However, the 2019 legislative agenda is going to start to be worked on in the next month or so. We just want to remind you that this is important to many people in our community, that the verbiage get changed for 2019. Even more so, we hope that it does not just get removed, but that it states that you support the exemptions that are in place so that there is no confusion. I have brought a few more letters from different individuals who also wanted to share why exemptions are important to them. We know your time is valuable, and I know probably the last thing you want to do when you're not here and you're not working and you're not with your families is read more letters, but from somebody whose life was very altered by not doing her own research and not taking the time to find out why maybe not vaccinating or changing the schedule would have been important to my child. I ask sincerely that you take the time to look into that, and thank you for your time today.
Thank you, Stephanie. Kim Sadler, please.
My name is Kim Stadler, and I'm from Spokane. I actually wasn't planning on being here today. Didn't really have anything prepared. But I spent last week watching the live stream of the vaccine hesitancy thing going on at the Washington State Health Department. And it rattled me a bit. And as most of you in this room already know, I have a daughter that was severely injured by the MMR vaccine 10 years ago. She suffered ADEM brain swelling, and it has put us on a course that I wouldn't wish upon anyone. And it made me think about some things, you know. When my daughter was vaccine injured, there wasn't social media like there is today. There wasn't Facebook, there wasn't all the viral posts about, you know, pro, anti-vaccine, anything like that. I think Jenny McCarthy was still doing Playboy or something, I don't know, but she wasn't representing me, and I wasn't listening to anything she was saying. It was a long discovery process of what happened to my daughter. And in that discovery process, I started meeting parents just like me, and we all had the same stories. I went from not knowing that vaccines posed any risks whatsoever to meeting people that had the same stories as me, with brain damaged children just like mine. And, you know, over the last really 5 years, when I really started becoming vocal about this, I've been called everything you can imagine. Conspiracy theorist is the big one. I get that a lot. And, you know, it just kind of dawned on me the other day when I was ranting to some friends that there's actually two conspiracy theories here. And we can say that I believe one of them. I don't believe it, I live it, for one. The two theories are that vaccines are perfectly safe, but somehow parents like myself, with absolutely no motive whatsoever, without any social media, all got together and started making up these stories about our kids. And we somehow also have medical documents, but that's a whole other thing. You know, but we made up these stories. Why? Why would we make up these stories? I've gained nothing from this. Absolutely nothing. I've lost my friends. I've lost my family. I've lost a job. Are we done? Okay. Well, I just want to say, that's a really wild theory to believe, that we would do something like that. And I know I'm going over time, but I just want to say, I am now having to go up against the biggest money-making industry in the world. I don't know how to do that. I need you guys to listen to me and to understand that I'm not making this up.
I understand that.
Okay.
Thank you, Kim.
And there's a lot of others that aren't making it up either.
Usually during my chair report, I introduce our new member, Ben, and so Ben, I'll wait until that comes time now, because I know that Kevin needs to, Josh too, to get to an FCA meeting. So at this stage, let's move down to the consent agenda, please. And do I have a motion to accept the meeting minutes of May the 31st, 2018, and also the vouchers May 1st through the 31st, 2018, and June 1st, 30th, 2018.
Move approval of the consent agenda as presented.
Do I hear a second to that?
Second.
Any conversation regarding that at all? Just for your information, for those of us, there was 15 pages of identified vouchers that you could look through and look at. And so I know that next month you'll have that same opportunity in order to discuss that at this stage. Okay, that being the case, we will now then go to, oh, I didn't done that yet? Oh, all in favor? Aye. Okay, thank you. Now you guys can go to STA meeting if necessary.
And one more action item. Number 7.
You want to do I hear a motion to accept resolution number 18-03, adopting the 2019 Health District fee schedule?
Do we want to?
Well, I'm going to get a motion and second it, and then he can discuss it.
So
Move acceptance of resolution 1803 as presented.
Okay,
second.
okay. Now, go ahead, Mike.
Oh, thank you. Thank you. Yeah, I'm here to present Resolution 18-03 to you. It is the adopting of our 2019 Health District fees that we would start on January 1st. And this is an important part of our budget process because this lets us continue in the budgeting by estimating and figuring out how much fees we're going to collect over 2019 so we can continue on the budget, and we stay on the budget process to bring the budget to you in October again this year. I know last year we got delayed till December, and that always gets pushes into other entities' budget cycle, so we do want to get back on track of bringing it here in October. I will let you know that this fee schedule was worked on very hard by all the division directors and the program managers, was presented into finance. I took it to both the Budget and Finance Committee and to the Exec Committee of the board that both encouraged me bringing it on to the board here today for adoption. So unless there's any questions on specific items, I'm looking for hopefully approval of the fee schedule.
Would you like to speak to that, Mary?
So as the chair of the Finance Committee, we did review it and approved it and did ask you to bring it forward. So you answered all our questions there.
Thank you.
Karen, would you like to say anything in regards to that?
No, I believe at the last executive meeting, we saw this, looked at it, and there were no questions.
Okay. All those, no further discussion at this time? All those in favor?
Aye.
Thank you very much.
Thank you.
We will now then go to, let's make sure I get it correct this time, shall we? Let's go back to, I think we're talking about the chair report now. And Ben, I'd like to introduce you as our new member to the Health District, and we're welcome. So if we'd like to say a few words at this time, you're welcome to do so.
Okay. I guess Ben Wigg from the city of Spokane Valley. I think I've had the pleasure of talking to most of our other elected officials here today, but glad to be a part of the team and group here and look forward to working together.
Okay. We're glad to have you aboard. Thank you very much. Committee reports. Do we have any? No report? Green?
I think we have met since we last met as a big group, and we just continued our work on figuring out a schedule to develop the legislative agenda and invite the legislators next fall sometime, and we just talked about some issues we were interested in that we'll be coming back to you with.
Okay, thank you. Mary?
No, our last meeting was discussing the fee schedule, so we've already taken care of that.
Okay, well, thank you very much. Now we'll have agency report, please.
We'll begin with the health officer report.
Just passing out some N95 masks, just so you get an appreciation of what an N95 mask is. And it probably is not a surprise, therefore, that I'm going to be talking about air quality today. This was Spokane last year. Air quality was not good, to say the least, and we saw quite a few days like that last year. I'll go through some of the data that will suggest to you that we're seeing more days like this of quality of poor air that, again, are of significant health concerns.
This was fire.
This was wildfire smoke. And yes, specifically what I want to talk about is really wildfire smoke with respect to air quality. I mean, air quality, as we look at it, is a function of a variety of different components of air. I really want to just focus on air quality as a function of wildfire smoke, which I think, again, we're going to be seeing greater problems with over the coming years. This is just a graph demonstrating how over the last decade plus we've been seeing increased amounts of wildland fires across the U.S. with respect to acreage burned. This is the total acreage in Washington State. 2015 was obviously a very significant year. 2016, not as much. 2017, again, a big year. But then if you look at this, this is a graph. This, again, is an aerial graph, or I should say an image of the western states. And the graph at the bottom shows the number of days where individuals across Washington state had poor air quality. Last year, if you remember, our area, and especially Washington state as a whole, was really sort of in a confluent area of wildfire smoke coming from Montana, Idaho, Oregon, British Columbia, and obviously within Washington state. And so although the graph previously did not have as many acres burned in 2017 within Washington state as 2015, irrespective, the air quality was actually poorer last year than we saw in 2015. What is in wildfire smoke? Some of the many things that, again, you find, it really is a function of the combustibles and how the fire is occurring. So it's a variety, again, of particulate matter, of aerosolized materials, metals can sometimes be found again. And again, what I really want to emphasize today is what's called particulates, and specifically PM2.5. This is a pretty impressive image. Again, you'll see a hair follicle, and then you'll see a grain of sand, giving you relative sizes. And then you'll see, again, when we talk about PM10s and PM2.5s. PM2.5s are incredibly small, particulate matter 2.5 microns. And what happens is these particles are so small that when they get inhaled, they get down into the deep portions of the lung, and then actually can get out into the vascular system. And what they do is they cause significant inflammation, and it's the problem with inflammation that causes a lot of the health-related problems. So we know that just the local irritation, okay, the runny eyes, the runny nose, coughing, but again, individuals with significant respiratory problems like asthma and COPD, chronic obstructive pulmonary disease, these conditions are exacerbated by poor air quality, and again, the inflammatory component of PM2.5 just makes this worse. Individuals with underlying heart disease, okay, it's been demonstrated that people who are exposed both acutely and maybe chronically to, again, poor air quality can have abnormal heart rhythms, more susceptible to heart disease, more susceptible to actual heart attacks. And during periods of poor air quality, we have historically seen, again, more hospitalizations, more visits to urgent cares and primary care physicians. Who's susceptible? Well, we look at susceptible populations, and again, you'll see a list of those individuals who are especially susceptible, but again, I would argue that essentially everybody is susceptible, because we really don't know, we really don't fully understand at this point, the degree to which these inflammatory substances can really cause problems. I mean, it's been suggested, there's evidence, although it's not causal, but at least associated, that it may be, again, people with diabetes. You may have actually individuals who have succumbed to diabetes as a result of exposure to wildfire smoke and to particulate matter because of the inflammatory component. So again, I think there's a lot of research pending on the health effects of wildfire smoke. There's also environmental effects. And when I mentioned to you before about the heavy metals, okay, again, it's because of the deposition of metals in the air through wildfire smoke that, again, we see a lot of these problems ongoing. So this is, again, if you will, this air quality guide for particulate matter. The colors, again, I think sort of represent, if you think of the green, yellow, red stoplight, okay, green is good, yellow is not so good, red is bad, and various colors beyond that are worse. And so you'll see again, if you were to, for example, go to Spokane Clean Air and you would look at this document closely, it sort of stratifies the groups, and again, when you should be more concerned. So those individuals who I mentioned earlier who are of special concern, those with cardiorespiratory problems, young children, seniors, pregnant women, those individuals who, again, are at higher risk of the complications of particulate matter in wildfire smoke. This is a guide that is made use of locally and actually across the state in many areas that, again, suggests to individuals with respect to athletic performances, different activities, when you may want to consider changing your activity. And this is just a graphic representation looking at the number of poor air quality days over the last couple of years. And again, you can see that in 2017, a significant bump up. 2016, not that bad. 2015, bad. But again, more overall poor air quality days in 2017. Today's level was 59. What does that mean? When you look at the AQI, it's a little confusing. The AQI, there is both a current level and a daily level. Okay, so the current level, what they do is it's measured over a 12-hour period, and it's a weighted value, it's a weighted index with more weight given to the last couple of hours. So it kind of gives you an idea of how things are trending. So a lot of individuals, unfortunately, they'll go to these websites and they'll see a number, and they'll say, oh, okay, that's right now. It's actually not right now, but rather a value that gives you an idea of what the air has been and maybe where it's going. The science, however, and the numbers, when we look at air quality, really it's specified on a 24-hour basis, measured midnight to midnight. And so you'll see a value right now. The health effects have been identified as being of concern of 35 microns per cubic meter of air. Okay, that equates to 100 on the AQI. So AQI, again, you'll see measures 0 to 50, 50 to 100. 100 is where the red starts, and then we start looking at concerns. But the health effects, again, don't equate with that number that you'll see commonly put out as the current AQI, so it's a little bit confusing. Bottom line is they use the colors, and I think the colors, again, are sort of self-explanatory. As you get darker, you know that the risks are greater, and therefore exposure is of greater concern. What do you do? Here's how you reduce air, here's how you reduce exposure, okay? Simply put, the best place to be, especially if the air quality is overall poor and or if you are in one of those high-risk groups, is to get indoors. It's been suggested that you can improve air quality by 35 to 85% and decrease your exposure to PM 2.5 by just being indoors. That's going to cause people to change their behaviors. But the reality is, on bad days like the ones I showed you before in that image, you shouldn't be outside exercising, and if you don't have to be outside, you don't have to be outside. And then just some other simple means by which you can improve and, again, keep indoor air clean. I passed around masks, and I'd have you just take a look at those. Those are called N95s. They, again, when fitted, they will lessen your exposure to 95% of the particulate matter. Now, those are different than the ones you're going to buy at Ace Hardware, which is, again, larger stuff like sawdust. But I emphasize the word fitted. Okay, so fitted means that you're tested, and it's actually, they measure the amount of air that gets around the mask that leaks out. Okay, now I will share with you that when I tried to get fitted last year, I could not get fitted properly in a mask. And I tried 3 different masks, and I couldn't find one that fit on my face appropriately to give me the amount of protection I needed for an N95. So you'll hear people asking, should I be wearing masks? Will it help me? I would say maybe. It depends. Okay, certainly it's better than nothing. People with cardiorespiratory disease, they put on one of these masks, they try walking, they try doing anything. It's a false sense of security, and again, it may actually make things worse. But the general public, again, if it empowers people to feel like they may be doing something, it's not going to necessarily hurt, but it's also not going to be the panacea. It's not going to be the thing that's going to stop the problem. And so essentially the message is, again, somewhat mixed. It depends. I will not discourage masks, but I'll also not tell you to use the masks because that's going to prevent you from the exposure to the problem that we mentioned before. What's been exciting working here at the Health District this year is that we were very proactive. We actually started these conversations back in May. Internally, we had a conversation about how to go forward with appropriate messaging, how we were going to be approaching the situation. We actually had an agency meeting that included Clean Air. We talked with DOH, Labor and Industry, about how we were going to get consistent messaging. Kim Papich, who's our public information officer, was meeting with meteorologists yesterday to look at consistent messaging with Clean Air. And EPA is coming out with new guidelines and new information this fall, and there's actually a working group that's being put together by DOH to, again, work with health officers and other elected officials and with people from environmental public health to kind of understand the science that's evolving, and how we move forward with maybe, unfortunately, a new norm. Some resources. This is a great local and regional resource, the Washington State Ecology blog. And the EPA likes this, and for those of you who have apps and you want to know what the air quality is where you are, you can download this app on your smartphone, and you can put in your zip code, and it will tell you what the air quality is where you are at that time. Questions?
So at what point, when we looked at your slide with the colors, at what point during that, as the air gets unhealthier, at what point do the warnings go out to the public?
You will essentially, and it's actually 6 colors here. Green is good, yellow, orange, okay? So it says unhealthy for sensitive groups. So those sensitive groups that I mentioned to you before. Seniors, people with underlying cardiorespiratory disease, those individuals where, again, be cautious, don't go outside if you don't have to. As you start getting lower down on the color schema, it says essentially it's unhealthy for everyone. Warning messages going out, warning messages expanded, that they're really, again, you need to be, should be looking critically at whether you need to be outdoors, and if you don't be. But we start, and again, clean air is really, again, going to be a great resource for folks, and they will, again, a good relationship, a good partnering relationship with us. We're sort of in conversations with them, but the warnings are basically based upon from that yellow sort of color down is when you start hearing the messaging.
Perfect, thank you.
Any other questions, Bob?
I have a question about schools, public school system. Is that correct?
Is your mic in? I thought I was the only one that didn't do that.
Okay. Communication with the public schools, when does that happen, like for after-school sports and things like that?
And so that gets into this graph. It's a conversation. As you can imagine, it's challenging sometimes to tell schools that you may want to consider rescheduling your event. Practices, physical education classes, things of that sort. So because children tend to breathe faster, their intake, their inhalation of these particulate matter and other air problems are again enhanced. You're exercising, and obviously your respiratory rate increases even more so more inhalation, more intake of this. So we tend to discourage participation per this. This, again, is a document that's been put out by Clean Air, by the EPA. There are health messages there. And I will share with you that this was a conversation that we had earlier in the year. Should we revise this? You'll note that actually if you can sort of maybe pick up a color gradient as you're going from left to right. So it used to be just red, then maroon. We try to illustrate, if you will, that it's a continuum. These values, as I mentioned, this is based upon an index, which is over a 12-hour period, but it's trending, so we're looking for trends. And so I can give you a value right now, but in 5 hours it may be different, which is a little confusing to folks. So it's difficult to, again, look at an absolute number as that value right now. Where's it going to be in 5 hours? If, however, you look upon it as a trending number, okay, are you seeing these values trending up? Then maybe you may want to give consideration to how you are going to change your activity. And schools, again, are using this as a guide. So.
Any other questions? Anything else, Bob?
Have a good day. Have a mask. Try the masks on.
It probably won't fit.
Probably won't fit. Okay.
But they have to be fitted professionally, right? I mean, it's not like I think it fits.
Yeah, as I was telling Dr. Condon, when I went to try fitting, how they actually fit the mask is they punch a hole in the side, and then you put it on your face, and then you have to go through a variety of physical maneuvers, not just sitting there, but actually moving your head side to side, standing up, moving around, to actually ensure that it's fitted, that you're not having leakage, and it's not that easy. So
to be truly a fitted mask, a fitted N95, it's a professional process. It's not just you getting the mask and pinching it on your face and making sure it feels good. That's how I did it.
The attorney, please.
Good job.
Well, good afternoon. I want to share with you a few things that have been going on here recently. One very exciting thing is that work that we have been doing with health equity. We have been utilizing an organization out of Oakland, California, Human Impact Partners, who does this training all across the country. And as a piece of this, Human Impact Partners has a fellowship that is offered, and this year we are the only jurisdiction nationally that has 2 representatives that they've selected to participate in their year fellowship. On the left is Helene Dewey, and on the right, Rowena Panetta, who have been leading the work and the education in our organization around health equity. I think that you are all aware that we will be doing a much larger event for us as an agency, our all staff, on September 20th. And the keynote for that is Dr. Tony Iton from the California Endowment. He was a former health officer in Alameda County, California, a Canadian-born physician who is an incredible speaker. That morning of the 20th, he will be doing a breakfast event for us for much broader community members. We will send each of you an invitation should you wish to come to that. It will be at Washington State University. I can't tell you the exact building at this moment, but WSU is hosting that for us. So we are thrilled to have these 2 ladies helping guide us going forward. It means the work that Kresge has funded this last year and the work that we have been doing internally to improve our understanding and work on equity is something that will be moving forward very well for us in the following year. Just a week or so ago, Bob and Helene, who you just saw, and myself had an opportunity to attend the annual NACCHO conference in New Orleans. It was hot and humid, but a very good conference. And something that I think is important to think about is a piece that Bob has shared with us internally here a couple of times. There was a lot of discussion around the invisibility of public health. Most people don't know what public health does. And in fact, I would congratulate our chair, who spends time coming and going with programs on a regular basis annually. And we welcome any of you to come, coordinate through Ann, and we can set you up to visit with any of our divisions to learn more about specifically what they do. That invisibility is something we need to continue to challenge. Another key topic throughout the conference was addressing equity. Helene and I did a presentation for the Kresge Foundation, and I had an opportunity to also do a second session with a panel of people from across the country. We have shared that we are in the process of working on our strategic plan. And so as we have moved through this, this has garnered input from lots of other work that we do in the agency, as well as looking at work that was done by Priority Spokane in doing our community health assessment and community health improvement process. What you see before you are the 3 bulleted items that have risen to the top for focus areas for us to pay attention to, and this is for strategic plan from 19 to 21. And though it starts at the beginning of 2019, there's an eagerness for folks here to begin to address these issues earlier than that. So we are in the process of doing that right now. We've had about 15 different staff who've participated in the planning for this next strategic plan. And in fact, the fourth goal of our existing strategic plan has been to work on emerging issues. And so this is a culmination of our existing strategic plan that ends this year. And it's been led by Lyndia Wilson and these variety of staff from across the agency. We are in the process of going through re-accreditation. As you know, we were one of the first 11 accredited health departments in the nation. We are also one of the first 11 being re-accredited. It is a very different process this time through. The first time was looking at showing documentation that could verify your capabilities or capacity. This go through, it is much more a narrative sharing of information where we have to talk about how we use those capabilities and capacities. The interesting piece is that they are assuming that our capabilities and capacities are the same as they were 5 years ago. That's not necessarily the case. If you look at us over the last about 3 to 3.5 years, 50% of our staff is new. We've had turnover, people aging out, and so on. We are making a concerted effort to assure that all of those capabilities and capacities continue to exist, but that's a piece that I think in this effort by the Public Health Accreditation Board that they're taking for granted that exists. Another thing that has gone on recently, on June 13th, there was a training on health impact assessments. And this is an opportunity, I think, for many folks in the community, and we had roughly 30 people participate, both internally and community members, to address issues about understanding the impacts of policy interventions on health. So a health impact assessment helps you do that analysis ahead of implementing policy to begin to understand those implications so that that can be done in a most effective way. We had representations from housing, transportation, education, and certainly public health as well. Another area that we're continuing to move forward on right now is our compensation study. This is looking at compensation levels for all our staff. We have contracted with Siegel Waters, a national company that is doing this work. We have set criteria. We have looked at the strategies on how we value compensation. So it is total compensation, so not just salary, but benefits, vacation time, and those sorts of things. They're in the process of taking position descriptions that we worked on to revise and update and create new classifications of those various position descriptions. And so the compensation study has a project team that has been working on it. It has been guided by our executive leadership team, and it will be done in time for us to work that into our budget process for the coming year. So with that, I would like to have our legal counsel, Michelle, talk about a recent ruling from the appeals court with the Margitan case.
Yes, thank you, Attorney. I gave to all of the board members the decisions that were issued July 24th by the Division III Court of Appeals, both in the ongoing appeal of the district's dismissal on summary judgment, and then the appeal by Hannah's of the verdict against them in favor of Margitan's. And speaking really to the one that involved the health district, the Court of Appeals determined that we were properly dismissed on summary judgment. And so short of the Washington State Supreme Court accepting discretionary review, that matter should be done. The only disappointing piece is they didn't award us our attorney's fees. But I'm glad to have that one finished. They also determined that the verdict had been incorrectly granted in favor of the Margitans and against the Hannahs, and reversed that. So I'm not as clear where that one's going to go from here. But thought you might like to kind of see the rationale of that. And I'd take any questions if anybody has any.
Okay, thank you very much, Michelle.
So any questions for me?
Any questions for Tony? Okay, thank you.
Thank you very much.
Okay. We next now will have a report on the Environmental Public Health Division overview. And I would like to state that yesterday I spent, 2.5 hours with you, Ray, and your administrative staff. And we could have spent the rest of the afternoon, I believe, just speaking about all the different programs they have and the things that they're involved with and their responsibilities. And it's unbelievable of what they're involved in and what kind of a job they do. So I do want to them personally thank you for allowing me to spend that time with you. And I would request and ask other board members that if you really want to find out the in-depth of what's happening within the health district, we have 5 divisions. And I think that you could perhaps make and visit with those and thoroughly get a well education regarding the health district. Same thing that you were kind of talking about, Tony. So thank you. So thank you, Ray.
All right, thanks. My name is Ray Byrne. I'm the Division Director for Environmental Public Health. And I would echo what Chuck was just saying. There has been several members of the board that have come out with us. And, the overview that we're going to do here is just a tip of the iceberg. So if you have the opportunity to come out and go out with us and actually see what we do, we would certainly welcome that. So this is our division. We're primarily made up of 3 programs, being the food safety program, liquid waste, environmental resources, and then living environment and special projects. And as we go through this, we'll kind of break those down a little bit and just give a little bit of the activities that we're doing within there. Certainly it's not a complete overview of what we do. And I'd like to start with foundational public health services and how that impacts the work that we do and what services, where we fall within that. Certainly the middle one there, environmental public health, that is the scope of everything we do falls within that service itself. We do some under chronic disease injury prevention, primarily under the injury prevention through our school program and our pool program. And then also through communicable disease, and that's disease response, investigation, whether it be in the food program, schools, pools, liquid waste, all of those, we do some degree of disease investigation through there. And then, of course, on the bottom there, the cross-cutting services, emergency response, policy development, and that. Certainly almost everything we do is related to that. So. Just talk a little bit about how we are funded. Primarily, we are funded through fees. The board passed a resolution years ago that mandated that programs that offer or that have permits and have the ability to charge fees attempt to recover up to 100% of costs for the program. Environmental health, all of our programs that we charge fees for are very, very close to 100%. Some of them are right on the threshold. We have to be careful that we try not to make a profit because public agencies cannot do that. So as far as grants, we have several grants. Those are primarily in our solid waste program, most centered around permitting facilities and complaint investigation, and then also local source control, which I'll give you a little bit of information on that as we go through. And then, of course, the last piece is some general fund. Some of our programs, primarily living environment, which is zoonotic disease, vectors, chemical physical hazards. There is no facilities to permit within those, so those are the use of general funds. And then also most of our complaint investigation across programs is also general fund, as we don't feel it's appropriate to send that cost off to the establishments for a complaint that someone's filing against them. So we'll start with environmental resources. Again, there's the primary components of that are liquid waste, that's septic systems, land use, plats, any subdivisions that are being proposed within Spokane County. We review all of those to make sure that they're in compliance with all the state codes, solid waste, and then our local source control. So in the liquid waste program, over the last 3 years, we have seen a drastic increase in the number of permits that we've been issuing. In 2008, our program took a pretty good dive with the recession. Since then, we've seen a gradual increase in that. In the last 3 years, that has really increased. So we've seen about a 40% increase just in the last 3 years. This year, we're pretty much on par, even though housing sales is up. on-site systems is pretty much on par with last year. Typically towards the end of the year, we get a push to try and get finals done before the winter hits. And again, that's the same thing with land development. With the recession, our numbers pretty much dropped off. We weren't seeing any new development going on. Over the last 3 years, as you can see, we have drastically increased in that. And this year, so far, our numbers, we are one shy of our annual for last year. Now, whether that's going to hold through or not is hard to say, but subdivisions and land development reviews are drastically up for this year. Just a couple things that I wanted to touch on, and these are things that have been in the public purview lately. One being the groundwater contamination with the Air Force Base. The Spokane Regional Health District doesn't have any real jurisdiction over this, but we have been asked to be advisory with this. The public water systems fall under the purview of Washington State Department of Health, and then the private wells, those are permitted through Department of Ecology. But they asked us to come in on a local perspective to act as the expert in relation to the public. So when they have questions, they will come to us, we'll give them advice. Most of that is centered around, what do we do to get tested? These are some numbers here. I won't go into the detail on that. But primarily, what do we do? If we want to get our well tested, where do we go? If it's high, what do we do about it? What can we do for filters? Is there financial release for that? So we take anywhere from 4 to 6 calls on average a week concerning this. This has been really cross-jurisdictional work with this because we're working with DOH, Department of Ecology, CDC, EPA. Currently, this is an advisory only. So there is no statute with requirement to meet a certain level, although the Air Force has made commitment to try and rectify the situation. Some of the things that are ongoing with this is the state, both at the state level and at the federal level, they are looking at moving ahead with adopting an actual standard, which would set limits and would be mandated. So we're in the early process of that here within the state, and we have Michael Scola currently sits on that panel for the adoption of that.
If I recall, this is services that this health district provides, and there's very little remuneration that's provided relative to some financial assets, and yet they need the help and assistance, so we take care of it for them.
Yes. Yeah, so that's kind of the key role here, and that would be some of the general funds that we were talking about that we would use to. A lot of times other jurisdictions turn to us as the experts, even though we may not have legal authority to cause them to do something, but we are looked for that. And I think that's across the board with the entire agency we're seeing for that. Something else that recently has come to light is USDA has recently done some statewide studies to look at groundwater contamination, specifically towards uranium and arsenic. They did some studies over the last couple of years. We don't have a lot of data here in Spokane County, but when you look at Northeast Tri, Stevens, and Ferry County, the levels of uranium and arsenic up there are very high. So based on the findings that USDA has found, we now have implemented where we've created some fact sheets that are now posted to our website. We've also started including a fact sheet handout with all of our on-site permits, which is more informational, just saying that be aware it has been found in the wells here, and we would encourage you to test for that. And then it gives some guidance as far as if you do detect it, what methods you can use to eliminate that. So the third thing is local source control. This is a program that's funded by Department of Ecology. It's a voluntary program working with small waste producers, so your auto body shops, mechanic shops, anything that uses toxic chemicals. And the goal of the program is to work with them to educate them both on what chemicals they are using and see if there's alternative to those, a more safer alternative to those, but also how are they disposing of them? And so it is, again, voluntary. We go in and work with them to do that. And that kind of goes hand in hand with the efforts that the city has right now with their overflow storage tanks for wastewater in trying to reduce toxics going directly into the river. What we found in the past is that some of those we're dumping them into the storm drains, or they're dumping them into their drains, which may be bypassing the waste treatment center. So this is an effort to do that. As part of that, we work with the Spokane River Regional Toxic Task Force. That's a collaborative that we have with them, and they work hand in hand with us on that. Living environment. This is the three primary things: water recreation, school health and safety, and then vector and zoonotic disease. So just a few numbers here about schools. We do inspect all public and private schools within Spokane County, and that includes from the ground up. From the time that they purchase that land, we do a review on the land to make sure what was there before and if any action has to be taken before the school can be built. We work with the engineers and the architects through the design phase, approve the plan, through the construction, do a pre-occupancy, and then go in and do a follow-up annual inspections of all the schools here within Spokane. And those are just some numbers as far as where we're at with schools. Water rec, again, we do all public and semi-public water. The semi-public are your apartment complexes. We inspect all of those, again, from the ground up. So the initial phase where somebody wants to build a pool, we would take a look at the plans, approve it, oversee the construction, and do a final pre-occupancy on that. And again, then we go out and do annual inspections of those pools and work with the operators to make sure that they're properly operating. So the vector and zoonotic diseases, I'm going to turn this over to Sandy Phillips. She's our technical advisor for living environment, and she's going to walk you through some of the things that we're doing there and then some of the efforts that we're going with.
Thanks. Afternoon, everybody. Yeah, so just for those of you that might be unfamiliar with those terms up there, because we like to use technical terms, a vector is an insect or an animal that can transmit diseases. And zoonotic diseases are those diseases that can be transmitted from animals to humans. So, of course, the purpose of our program is to prevent the transmission of these various diseases to people. We do that through education, consultation, and some surveillance. So the majority of our program, actually, the biggest chunk of time that we spend is focused on prevention of the transmission of rabies to people. And that's particularly at this time of year when we actually deal a lot with bats that people or pets may come into contact with. The rest of the year, it's mostly dog and cat bites. I think I read something in the Seattle Times a few years ago that Spokane actually has one of the highest rates of pet ownership in the country, along with Seattle, so we're dog and cat lovers here, so there's lots here. Anyways, we partner with scraps mostly to follow up on reports of animal bites and follow up with dog owners and animal bite victims to ensure that there won't be any transmission of rabies. Some of the other partners that we have, we work a lot with vets, both at Department of Health, sometimes Fish and Wildlife, and also private vets out in practice in the community. We work with epidemiologists, both at the Health District and the Department of Health, and various other people as we try to follow through on bite resolution. Anyways, we've seen an uptick in animal bites here, as you can see from that chart on the left there. We're up in the 800 range, and in fact, I think yesterday we passed the 500 bites for the year level, so I think we might be on track for even more than 800 this year. We've tried to streamline our process, and we actually handle them on a risk base, so low, medium, and high risk in the amount of time and effort in the way we resolve them. And we do have to send animals for rabies testing to the Washington State Department of Health Virology Lab. And those are typically mostly dogs, cats, and bats. Occasionally might be a raccoon that somebody's come into contact with, or a dog, and then the dog had contact with the owner. But anyways, again, we've been sending more samples. So typically the last 3 years, it's been in the 50+ range that we sent for testing. I just checked. Yesterday it was 32. I think we're sending another bat today, so we're up to 33 total animals, and actually half of those are bats. Now, in terms of positive samples for rabies, I believe last year we had 2 positive bats where humans in Spokane County had come into contact with those bats. In the case of testing positive, they then have to go through the rabies post-exposure prophylaxis treatment, so the rabies vaccine where it saves their life. Because rabies is a disease that is basically 100% fatal. There have been a couple of cases that have survived with some very unique treatment, and Bob could talk to that. But anyways, and it is transmitted through a bite of an infected animal into a wound or open skin, and it's the saliva that actually transmits the virus. So anyways, we've had quite a few. But in terms of positive, it's like 1 or 2 maybe a year. So there were 2 positives last year for humans, and then 1 pet. This year we have 1 pet positive bat contact. And then another one that actually came from Pend Oreille County, because sometimes people go stay in their cabin and then come back to Spokane on the weekday, on Monday, and then give us a call that, oh, there was a bat in my cabin. So we sometimes do send, in those cases, we'll ship for that county over to the state. And we had one from Pend Oreille that was positive. Oh, sure.
Quick question for you. When you want to test a bat, how do you get them? And how do you know that you've got the right one?
Good question. And actually, I have a slide right at the end that shows how we're trying to educate the public on that. So there are actually instructions on the State Department of Health website, and then also on our website, we started a new campaign called Bat Smart last year, and a lot of the reason was for that purpose, to have some written directions telling people how to safely capture it. So typically it is the person who's exposed, and we instruct them on how to safely capture it, because we don't want them being exposed again if they weren't actually in the first place. They can also hire a nuisance wildlife company to come out and do that. That's an option. There is a cost for them to do that. And then we instruct them on how to transport it. We have a vet here locally that we've been dealing with for many years on contract to actually prepare the samples for us. So the bats, he euthanizes them humanely, and they get them ready for us to come and pick up for shipping. So does that answer your question?
Except, and again, this is my ignorance of bats, but it seems like there's a lot of them. How do you know that you've gotten the right one?
Oh, well, let's see, a common situation is somebody wakes up, finds a bat in their house. If the policy is, if people have been sleeping and their doors have been open and they find a bat in the house, we just assume there could have been an exposure, and we will have them capture that and collect it and take it for sampling. If it's outside, there's less likely that there's been any contact, but if there has, we had one case, I think 1 year, in a park where a child was bitten by a bat. In that case, if it's really sick, usually it's not too hard to catch, because often they're not flying, they're on the ground. And then it's like using a net or a towel to throw over it, capture it, put it in a container, and take it. So, okay. So moving on, there's a few other diseases that we try to prevent transmission of. Hook-billed birds can carry psittacosis. Reptiles like turtles and lizards can carry salmonella, along with the little chicks that you see in the farm supply stores in the spring. And then goats and pigs and things like that can carry E. coli and Campylobacter, and those are things you might see at a petting zoo. So what we do is we work with pet shops. We visit them a couple times a year, just educational visits, try to educate them on their responsibilities to let the public know that animals can carry disease and how that they should protect themselves. So we have signage that they can use to post to let people know that they need to wash their hands after handling animals. And then the venue needs to supply some hand washing facilities as well. So in addition to pet stores, there's also petting zoos like the fair. We work with them every year, and other little traveling petting zoos also. And then also schools, which sometimes have animals coming in petting zoos, and also animals in the classroom, which we don't see quite as much anymore, but still. So that's mostly what we do with that. Mostly it's educational and providing resources for people to educate the public on that. And then in terms of other vectors, we do a lot of education of the public. We get quite a few questions different times of the year on mice and hantavirus. So if people are opening up their cabin in the spring, or maybe tool sheds, that sort of thing, and they have a mouse problem, there's concerns about hantavirus, and it's the deer mouse that transmits that. So we have, again, on our website, we have some information on how to safely do that or hire somebody. Ticks, that's a spring issue, obviously. So educating people on how to avoid being bitten by ticks. And then West Nile virus and mosquito bites. Just a little bit of statistics on that. Last year, Spokane County, we had 8 people in Spokane County that tested positive for West Nile virus, and of those, 7 were actually acquired in Spokane County. I think the other one may have been from outside. We also had 8 equine cases here as well. The previous year we had 3 human cases, so we'll see how that, hopefully we don't repeat that again. Previous to that, I think we didn't have any cases here since 2009, and there were quite a few around the state 2009, and then it seemed to drop off, and now seems to be kind of a resurgence on that. So finally, as I mentioned, on our website, we developed a couple of campaigns because these are hot topics and things that we get a lot of questions from the public on. So the first one we did a few years ago was the Bring It Summer Pests. So that covers the mosquitoes, the ticks, and the mice. And this is just a cover page, but we have actual handout sheets that go along with each of the topics. And then the Bat Smart to educate people on when they might have had an exposure and they need to call us, and also when they don't need to, if it's just a bat hanging under their eaves, but also give them tips on how to discourage them from hanging around their homes. So anyways, I will pass it back to Ray. Any other questions on that?
If I'm bit by a bat, what do I do?
Call us. And capture it if you can.
I don't call 911, I'm afraid
no,
I'm going to die?
I don't think so. They might call us.
Okay.
Thanks.
Thanks, Sandy. So the last program is the food program. Obviously, that's the biggest program that we have in EPH. And for this, we inspect all retail food establishments, so when the food is sold directly to the consumer. We work closely with WSDA, Washington State Department of Ag, who permits wholesale, and FDA, which is interstate. So as part of that, this is just some statistics that we have. Roughly, we have about 2,500 food establishments here in Spokane. In addition to that, we permit an additional 300 to 350 temporary food events. We have 9 inspectors right now. I think the biggest statistics, though, is the foodborne illness outbreak statistics. For last year, CDC estimated that 48 million cases of foodborne illness resulted in 128,000 hospitalizations and 3,000 deaths nationwide. So it's a big issue, and we devote a lot of time to that. So I'm not going to go into too much on the food, but one thing that we would like to report out is that in 2015, there were some vendors in some of the smaller jurisdiction cities came to the board and with the request that we review our temporary food event fees, as they said it was hard to recruit vendors into those venues because they just didn't have the sheer numbers. And so out of that, the board formed an ad hoc committee, which was made up of several board members, members of my staff in EPH, and then vendors, that temporary food event vendors. And then from that, we went back to the board, made a recommendation on some alternative ways in which we could permit them, and then came back with a revised fee schedule from that. And the board passed a resolution adopting those new fees and instructing us to do a pilot project for 2 years. So we have now completed that. It was very successful, and I'm going to turn that over to Jessica Martin, who is a food inspector for the district here, and she's going to go into a little bit of detail. We did do a quality improvement project in conjunction with that, and she'll share that information.
Okay, so yes, I'm Jessica Martin, one of the food inspectors, and we, out of the TFE ad hoc committee, there were 3 proposed options: a 100% cost recovery of our fees, which is what we strive for, an 83% cost recovery of our fees, or a 60% cost recovery. So the resolution 1509 resulted in that number 2, the 83% cost recovery. And like Ray said, that was a piloted program from January 1st through December 31st, 2017. So out of this, we decided to form a QI team, a quality improvement team, if you will, and we conducted a project. And the first thing we did to start our project was, well, we've always tried to have 100% cost recovery, so our overall objective was to reduce fees by 17% by that December 31st of 2017. So our data center here at Spokane Regional Health District held 3 focus groups with our TFE owners and operators on February 17th, February 25th, and March 15th of 2016. And out of that, the data center recommended the following based on that feedback from those participants, and those were to improve customer service, reduce costs, obviously, provide information to them up front, provide any advanced communications that we could of any changes, fees, applications, utilize our web-based handouts and applications as well. So because we were trying to streamline our TFE process, we focused on the last 3 there. And so during the improve phase of our project, we revised our TFE application. And again, a TFE is a temporary food establishment, and those are the food booths you see at the fair, pig out in the park, farmers markets, things like that. They're just temporary food sold to the public. We also revised our commissary agreement, all of our exemption information, and we revised our interview process. So when we permit a TFE, we interview them, and before we interviewed 50 questions, and there were a lot of redundancies in our process and our questions, and so we reduced that to about 13 questions. And our exemption information up front, we made up front, and we made it easier to read. And then out of that, we also created instructions for our application, an FAQ handout, and permitting requirements handout. And then we also started, because they requested that upfront information, we also started doing a pre-season email to any operator that purchased a permit the year before. We would send out an email pre-season, March-ish, and we would, include the application, any information up front with fees, timelines, and things of that nature. So for measurements, we looked at average time spent per TFE, total time spent on TFEs, and average number of violations per inspection. And so in 2015, right here in the green, you'll see that there was 3.23 hours spent on average time spent per TFE, and it decreased down to 2.5 hours per TFE in 2016, and down to 2.14 hours down in 2017. So that's great. While we were reducing our time spent, we wanted to make sure the quality of our inspections did not also get compromised. So we were measuring average number of violations per inspection as well. So in 2015, it was 0.78 number of violations per inspection, and you can see in 2016 and 2017 it really didn't fluctuate that much, and so that was kind of what we were hoping for. And then total was a 40% decrease of time spent from 2015 to 2017. And that's really about it for just a quick overview of our project that lasted 2 years. Any questions?
Please keep in mind that for the board members who were not involved back in 2015, I don't know how many sessions we had regarding how we were going to make it more efficient, but also to make sure the inspections were taken care of properly.
Yes.
And that we weren't remiss in the inspection simply because we didn't want to have some kind of E. coli come out or other types of diseases of that nature. So
that's
they
right.
did a good job.
Okay.
Looks like it was successful too.
All right, and one more thing. So currently, the regs that we enforce here are state-adopted regs, and currently there are 3 regs that have been opened up for review that are under the review process. Some of them will be adopted this year, some of them not out until 2021. So these are just the Washington State Food Code is again under review. The on-site reg is currently under review, and then the solid waste. And the reason I mention this is that under some of the regs, we are required to bring those back to the board for adoption, either by verbatim, in which we adopt the code as is, or we can make it stronger. So in the past, we have brought the food code back to the board for adoption because we have some fee related issues there. So if that happens, we certainly will do that. So any questions?
Okay. Thank you very much, Ray. And again, I'll express my thanks to you and your crew for yesterday taking as much time as you did in letting me review what you do. So, okay, with that being said, there will not be an executive session.
Correct.
Is that correct?
That's correct.
Okay. Citizen input. Anything you'd like to say, Ben? I mean, I'm sorry, no citizen input. We've taken care of that. We now have board member check-in. I got it. Anything you'd like to say?
Well, I guess just looking forward to being more involved, and I didn't realize the new guy had to sit on the opposite side of the room.
All by yourself.
Yeah, I know, right? I swear I showered today. I mean,
that won't be consistently happening. Okay. Karen.
There we go. I don't have anything to report. It was a big issue for nothing.
You don't have a story for us or a joke?
Oh, I do have a joke. I'm only doing one, and it's my favorite. Can I tell him who gave it to me? No? Okay. What do you call a sleepwalking nun? This is so good. A Roman Catholic.
Okay, thank you.
I think next time
Don, kind of no report and no jokes.
Just a brief report. The vice chair only has 2 jobs. One, fill in. Chair's gone. And secondly, coordinate the evaluation of the administrator. And some of you might know we changed up the job description of the administrator over the last 18 months. So I have the materials from the last time that we did such an evaluation, and by the next meeting I'll have some proposed steps on how to do that. So I'll be looking for help, but I won't ask till next month.
Okay. Mary?
I don't have anything to report.
No report. And with that, The chair has no longer, oh,
Just wanted to let the board know that Bob has been invited to participate on the state board event.
Very good.
good job.
I know, congratulations.
Right. We thank you for that. Now, with that, and any other announcements somebody else would like to make? Okay, with that, then I ask for a motion to adjourn.
So moved.
Second.
Okay, all done. Thank you very much. Have a nice day.